Hey everyone, in this video, we're going to discuss medical coding for pressure ulcers. If you're new to the channel, hey, I'm Victoria. I'm a medical coder, auditor, educator, and content creator. And on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. If you haven't already, highly encourage you to subscribe, hit that notification bell so that you can get alerts when I post new episodes. So let's talk medical coding for pressure ulcers. We're going to go over ICD-10. We're going to go over CPT. We're going to do a fairly simple case study just to kind of practice a little bit. But let's start by talking about pressure ulcers. So pressure ulcers are also known as decubitus ulcers. You may often hear them referred to as bed sores. And they are injuries that occur to the body because of pressure up against the tissues, the skin, the subcutaneous tissues, etc. From that prolonged pressure. You see this a lot in patients who are maybe disabled and they're sitting in their wheelchair for a prolonged period of time or laying in their bed for a prolonged period of time. Sometimes even depending on maybe a prosthesis that a patient has, there might be pressure up against the prosthesis and they might receive pressure ulcers there. And that's why it's so important to do things like move patients and rotate them around on a bed so they don't develop these pressure ulcers. Sometimes patients do get things like special mattresses to help relieve that pressure, but in some cases when they develop them, they might actually need surgery. So we're going to talk about some of those surgical aspects of pressure ulcers. But let's get into the coding, and we're going to start with our ICD-10-CM codes. If you go into your ICD-10-CM book and you look up the word ulcer, you can see there's a lot of different types of ulcers that are going to be here. But since this video is covering pressure ulcers, what you're going to be looking for is ulcer and pressure. If we look over here in our ulcer codes and we're going like to ulcer and then lower limb and then to ankle, it's going to take us to these non-pressure ulcer codes. So you have to be very careful when you are coding for pressure ulcers that you are going to the word pressure. You can also see here, and I'll zoom in so you can see a little bit closer. Remember how I mentioned that pressure ulcers are also often referred to as decubitus ulcers? If you actually look under decubitus here, it tells you to see ulcer pressure by site. So that's how the order that we're going to look up. We're going to go to the alphabetic index U for ulcer. Under ulcer, we're going to go to pressure, and then we're going to look for the site under pressure. So when we go here, under pressure, dun 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 dun, you can see we're here in the L89 section. That's where we're supposed to be in these L89 codes. Those are going to be our pressure ulcer codes. If you're in the L97s, that's not the right section for pressure ulcers. Those are just non-pressure ulcers. Pressure ulcers are broken down by location then and the stage of the ulcer. So you can see when you look under the index, it'll give you the locations, and then it has that little icon there that means we need additional characters. That's going to be for the stage. You can also just look under the stage and then by the location. So we do have them for the different stages as well as the unspecified stage, which means the provider did not provide the stage. So with pressure ulcers, we have combination codes. The combination code includes the cause, which is the pressure, right? It includes the location, and it includes the stage. The stage is essentially the severity of the pressure ulcer. So we have stages 1, 2, 3, and 4. We have unstageable, and then we also have deep tissue injury and an unspecified section. Stage 1 is it's red, it's kind of warm to the touch. Stage 2 is more like it's damaged. It might have some open sores or scrapes or blisters. 3, it may have like a crater-like appearance due to some of the damage below the skin surface. And then in stage 4, it's more severely damaged. We're going to notice things like maybe a large wound that's present. In unstageable, it means that the stage is not clear. It doesn't mean that the provider didn't document the stage. It means that it was assessed by a provider or a clinician, and there might have been some sort of like pus or tissue, or just because of the way the damage looked, they couldn't tell, like it's obscured almost by some sort of maybe slough. And they can't tell what the definitive stage of that ulcer is. So unstageable is not the same as unspecified. Unstageable is we looked at it, we can't determine what the stage is. Unspecified is we didn't document the stage. We documented nothing. So for example, an unspecified might be they just said pressure ulcer of the sacrum. They didn't provide you a stage. That would be an unspecified stage. Now, of course, when we're talking about our ICD-10-CM codes, we can't forget that we have some guidelines specific to coding of pressure ulcers. Now, there are some specific ones for like inpatient coding and regarding the inpatient stay and the stage documented for the inpatient stay when the severity changes. People ask me a lot, what's the best edition of the ICD-10-CM book? If you're going to be taking an AAPC exam, the AAPC versions have lots of little tidbits in them that are good for the exams. Now, of course, we're going to want to review our chapter-specific guidelines, which now in the 2023 edition of the AAPC ICD-10-CM book are right at the beginning of that chapter. You can see we're right here in our chapter 12, and here's our chapter 12 guidelines. But I actually want to draw your attention to just some general coding guidelines that we have in ICD-10-CM as far as who is allowed to document these stages of the pressure ulcers. So if we look at our guidelines for the conventions of ICD-10-CM, we will notice here under documentation by clinicians other than the patient's provider, we'll see here pressure ulcer stage. So if you've worked with wound care, you know that oftentimes a wound care nurse will document the stage of an ulcer. And according to our information here in the guidelines, that's permitted. However, what I will bring to your attention is it says this information is typically or may be documented by other clinicians involved in the patient's care, yada, yada, yada. However, the associated diagnosis such as overweight, obesity, acute stroke, pressure ulcer, or condition classifiable to F10 must be documented by the patient's provider. So while the wound care nurse can document the stage of that ulcer, we have to have that provider documentation specifically saying this patient has a pressure ulcer. And then it continues on to one of my favorite statements stating that if you find conflicting information in the patient's medical record, you need to query the provider. And then one of our other pertinent guidelines I want to remind you of is that if the patient has multiple pressure ulcers, if they have one of the sacrum, they also have one of the ischium, which is the hip, we can use as many of the different pressure ulcer codes as we need to capture all of those patients' injuries and the extent of those injuries. I also want to state, and I have a feeling this might at some point get shown to a provider, but when we look at the way things are mapped in ICD-10-CM, a wound maps to a very different code than an ulcer or a pressure ulcer. So it's really important to use those terms consistently. Sometimes we'll see providers that'll be a pressure ulcer or a decubitus ulcer, then it's a wound, and those code very differently in ICD-10-CM. The wound codes actually oftentimes will map to different S codes. So if we're here looking at, sacral region wound, open back lower. So here it's taking us to these S31 category codes versus the L89s for the pressure ulcers, which is where we're supposed to be. And I know providers get frustrated because of the semantics, but that is just the way it is for the coding guidelines. And it could possibly even impact things like, covered diagnoses for certain services. We don't want to have the patient get their services denied and then have to put in extra work. And then the patient's upset because their stuff's not getting paid and they're having to go back and forth between the provider and the insurance company. As a coder, I know, yes, it is semantics. Yes, we as coders know what you mean. We know it's a pressure ulcer. We know it hasn't changed over to a not being a pressure ulcer and that it's just a wound. In order to classify it correctly with the code sets, it has to be documented a certain way. But I certainly sympathize with the semantics of how medical coding can be. So let's talk about some of the surgical treatments for pressure ulcers. Of course, we have debridements, which means that they're just removing certain portions of the tissue that are maybe diseased or need to be cleared to get down to that healthy red tissue. If they're just doing a more superficial layer, we're probably going to look at those codes from the 97597 through 97602. Those are way in the back of the book in the medicine section. And then in the integumentary section is where most of them are. So a debridement of subcutaneous tissue, of muscle tissue, those are our 11042 through 11046 codes. And they are broken down by the size and the depth. Swap over here to my CPT book so I can give you a little look. So here, for example, 11042 is our subcutaneous. 043 is our muscle and or fascia. Now they are broken down by size. So here's our subcutaneous. This is the first 20 square centimeters and then each additional 20 square centimeters or part thereof. It doesn't need to be a full additional 20. It could be an additional if we have 21, for example, we would code 11042, and that additional part thereof would be 11045. Oftentimes with things like ulcers and wounds, when we're talking debridements and adjacent tissue transfer rearrangements, if we're talking skin grafts, these are the areas where we have to kind of do the math in medical coding and figure out things like square centimeters. Oftentimes providers will not give you the square centimeters, and you should not be querying them for square centimeters if they provide you the information to calculate the square centimeters. For example, a provider might document the ulcer is 5 centimeters by 5 centimeters. So in order to calculate the square centimeters, you times them. So 5 by 5 is 25. So 25 square centimeters. And then you need to take the 25 square centimeters and convert it over to units. So let's go back to kind of our example with the 11042s. Oops, there we go. So if we were doing 25 square centimeters, we had that 5 by 5 is 25 square centimeters. We would have our first 11042. We would have 5 left over. That's one part thereof of 20. So we would have 1 unit then of 11042. And I will also mention, because I know this is another sore point for providers and coders when we're having these conversations. So we have this breakdown of, subcutaneous tissue, and then we have our muscle tissue. Those are 2 different code sets, right? So when a provider documents, I went down to subcutaneous tissue, is that in the subcutaneous tissue? No, it's on top of. If I go down to the floor, am I in the floor? No, I'm on top of the floor. So again, just a little bit of semantics there. If the provider is taking out some subcutaneous tissue, they're debriding subcutaneous tissue, they need to say they're into the subcutaneous tissue or involving subcutaneous tissue, not I went down to the subcutaneous tissue. Now here's the section you're probably going to think about a lot when we're working with pressure ulcers, because this is the one that says pressure ulcers, right? But that doesn't mean this is the only section we're going to use for pressure ulcers. Like for example, this one here is for an excision. So an excision is different than a debridement. A debridement, we're just taking away some of that dead tissue that we see. We're not excising the whole thing. These codes are excision codes, meaning we're taking like an ellipse and clearing out that entire ulcer versus just we're cleaning out some of the tissue. We're just selectively debriding some of it. So this excision is we're making that full ellipse around it. We're taking it out. So this one is for if we're doing the ectomy with primary suture, and then this is with a flap closure. It tells you over here that you should also use the appropriate flap code. Keep in mind too that what we sometimes clinically refer to as a flap or any piece of vascularized tissue may in fact be a rotation and adjacent tissue transfer per CPT definition. So when they say flap here, they're talking about the genuine flap codes. They're not talking about adjacent tissue transfer rearrangements. We're talking these. We're talking the things that are under the heading that says flaps, flappity flap flap. Some of the codes do include the osteectomies, so definitely check for that terminology if we're doing the osteectomy with primary suture or we're doing the skin flap with the osteectomy, etc. And of course, some of them it says skin graft, and that's another big area for calculating math in medical coding. I actually have a whole video where I talk about skin grafts and how to calculate for them and convert them into units. I'll link it up here. I'll also link it at the end of this video to the next video and in the description below. So we have dermal, we have full thickness, we have split thickness grafts, we have different sizing based off of these different locations. They're not consistent. One that might be 20 square centimeters in one area might be 50 or 100 in another. So we have to pay very close attention to the type of graft, the size of the graft, the location of the graft. So where are we placing that graft? Again, you definitely want to check out that video that I have on skin grafts if you're curious about coding for skin grafts. Now let's actually get into an example. So I have a sample here. I kind of modified it from one that I found on mtsamples.com. mtsamples.com is a free resource for medical transcription notes. They don't have medical codes on them. It's not for medical coding case studies, but they do say that you can use their cases for things as long as you credit them. So I like to occasionally pull them for examples and kind of tweak them a little bit because some of them are old or confusing. Now, I'm not going to read through this whole thing because what I'm going to do is I will save this as a PDF and I will link it below so that you can read it all yourself and you don't have to listen to me. Although I've heard some people say that I have a very nice voice. I feel like I should sell an audio version of just me reading the ICD-10-CM guidelines. If you're interested in that, let me know in the comments below what you would pay for an audio version of just me reading the ICD-10-CM guidelines. But here is our preoperative, postoperative diagnosis. They are the same. We verify in here that it is the same. There's nothing different. It didn't change to anything. So our left ischial pressure ulcer is our left ischial pressure ulcer. One of the first things you have to understand is that in ICD-10-CM, they're not going to list for you that it's the ischium. You have to know that the ischium is the hip. How do you know it's the hip? It's one of those weird things that I feel bad saying this to people, but you have to know by knowing. If you go under ulcer and then pressure and then ischium, it's not going to be there. So you just kind of have to, I guess, work through it and know that the ischium is the hip. When I first started doing wound care, I had to Google what the ischium is because I didn't know that one off the top of my head. But here it is, hip. So you can see we don't have ischium, we do have hip. So L89.2, and then of course we're going to need some additional characters for our stage. This one, if you noted, they didn't give us a stage. Does that mean it's unstageable? No. It just means that they didn't give us the stage. So we're going to use an unspecified stage. We could also go over to pressure and then unspecified stage and then hip. And it might give us, let's see, L89.2. So it's given us the same starting point, L89.2. Sometimes ICD-10 is just so kind to us and gives us more than one way to skin a cat. So L89.2, where are we? Pressure ulcer of the hip. And look at this. We have unspecified hip. We have right hip. I'm betting if we flip over, we'll have the left hip. What did it say on here? Did it say right or lefty? Yep, we have the left. So we're going to go to, we're on the right. We got to flip around. All right, here we are. Pressure ulcer of left hip, unspecified stage, L89.229. L89.229. I'm going to double check that, L89.229. I trust that everyone would be very quick to point out if I accidentally transposed a number. It has happened once or twice. Now, in this case, I will also show you, this was they show here the debridement. And again, I'm not going to read it, but we do have down here the 5x5. 5 times 5. If you remember from earlier, 25. I bet you didn't know that I was going to be your math teacher in this presentation as well. So 5 times 5, 25. We can verify here. He says that he was down into subcutaneous tissue, not on top of, not down to, into. So let's flip over to our CPT book. So we're looking at these two codes, our 11042 and our add-on code 11045. So this is our first, again, 20 square centimeters. We have 25 square cm. You may also see it documented as 25 cm squared. That means it's already squared. So if the provider gives you the cm squared, that's like the total. That's not like you don't take that and multiply it by itself or anything. Sometimes people struggle with the math. So if we have 25, here I go again, 25, we're taking away 20 square cm for our first unit, and we have 5 cm squared left over, okay? So that's our 11042. Let's just put that over here, 11042. And then we have, the next 20 square centimeters or part thereof is our 11045. Do we have a part thereof left over? Yes, we do. Do we have enough for multiples of our add-on code? No, we have enough for up to one part thereof up to 20. So this is our 11045. So we have 11042 for our first 20, 11045 for that part thereof. And that's it. That's all we're coding for. We've got our non-healing decubitus ulcer left ischial region. We've got our debridement codes. We didn't do any flaps or grafts or anything like that on top of it. So I hope that helped you out. I hope it gave you some good visuals on how to work through some of these situations with pressure ulcers. Again, if you want to see more specifically on skin grafts, I have a whole video on skin grafts right there. I also have another case study that I will also link below. But yeah, let me know. I know some people say I talk too fast, but other people will say, oh, you have just such a wonderful voice. I like listening to you. But if you would like to hear a slowed down version of me reading through ICD-10-CM guidelines, coding things, just to say, you want me to bring my podcast back? Hey, let's talk about it. Let me know in the comments below. I'll see you guys in the next video. Until then, just keep on coding on.